What's crucial in the post-operative care is to follow up your patients really good. So I have a periodic schedule for my patients to come. I don't like the patients who will have their surgery and come back only if they had a complication. No, I need to follow up my patients to prevent any complication from happening. So they have to stick to the schedule of their visits. Every 1 month at least I would see the patient, and then every 3 months, and then once a year. And I follow my patients up to 20 years. I don't care, once a year is not a problem for me. But to see the long-term effects of my technique. That's the only way you can learn, and that's the only way you can improve your results.
In the post-operative phase, it's very important to prevent infections. Therefore, we always give intravenous antibiotics just before surgery, and also post-operative to use antibiotics. You don't want to have a hematoma. Hematoma formation is very annoying, and also nose bleeding. So therefore it's helpful to use cold packing on the nose. You can even do that direct after the most traumatic part of rhinoplasty, the osteotomies, and it helps quite a bit to prevent that.
If osteotomies have been done, obviously it's very crucial not to do anything that can displace the bones. It's in terms of wearing glasses, it's in terms of blowing their nose, it's in terms of just being as cautious as possible. What I like to do as well is taping the nose, because it actually pushes the skin down to the cartilage and bony framework and reducing the edema, and it's improving the healing. What I like to do as well is to apply some ointment, antibiotic ointment, preferably with some steroids, just to improve scar healing and to decrease the infection rates.
Post-operatively, you have to obviously keep a very close eye on your patients, especially within the first few weeks, because so many things change with rhinoplasty. And yes, if there's swelling, there's things that we can do, from taping to injections with Kenalog steroid injections or 5-FU. I find those all to be effective in the early post-operative phase. But clearly also, which is important, is that I'm talking with the patient and I'm managing them, because there's always going to be some sort of psychological adaptation that's going to have to happen to their new nose. And that is a much more critical component and a much more impacting component than we may recognize.